Hello, and welcome to Gun Violence in Missouri, Seeking Solutions, presented by the Kansas City Star in partnership with American Public Square at Jewel and the St. Louis Post-Dispatch. My name is Denisha Snell. I am the Program Director for American Public Square at Jewel. In the last several months, the Kansas City Star, along with the Springfield News Leader and the St. Louis Post-Dispatch, have interviewed citizens, activists, faith leaders, and survivors of gun violence as part of their Missouri Gun Violence Project. This project was undertaken in partnership with the nonprofits Report for America and Missouri Foundation for Health. Today, we've assembled a group of panelists who are not only passionate about eradicating gun violence, they are also focused on exploring solutions. The goal of today's event is to engage community members and work together to develop long-term solutions to reducing violent crime in Missouri. We want to have a civil, fact-based discussion about violence as a public health issue and how we move St. Louis and our state forward. As part of the American Public Square and Kansas City Star programming, we welcome questions and fact checks from the audience. Please comment on the live stream with your questions or requested fact check. Ian Cummings, reporter with the Kansas City Star, will serve as today's fact checker. With that, I will turn it over to our moderator, Denise Long, consultant and trainer for trauma-informed care and racial equity, and adjunct faculty at Southern Illinois University. Denise?
Thank you, Denisha. I'm honored to be today's moderator about this very important community conversation. Exploring gun violence as a public health issue gives us the opportunity to examine violence from this perspective of social determinants of health. Social determinants are those elements, factors in a community that determine whether it's healthy, protected, or if the people developing in it are at risk. By better understanding social determinants, we know that acting on them, we can better identify the solutions that will move us forward toward health and community well-being. For many years, St. Louis has had one of the highest gun violence rates in the United States, and this year will be no different. So far, the city has experienced 225 deaths from gun violence. That startling loss of life puts the city at risk for a level of gun violence deaths that it hasn't seen in decades. Public health experts say that gun violence is an epidemic, specifically that it's spreading as any communicable disease does. The uncontrolled spread of gun violence continues to infuriate the doctors who continue to see the victims and the suffering families who are surviving it. Public health experts say that access to high caliber weapons and poor public health infrastructure are key factors during driving the violence in our city. We know that poverty, education, social unrest, racial inequalities, food and housing insecurity all contribute to the health and well-being or the risk of a community, and they can be addressed with a robust public health system. So to begin this conversation today, I'm going to introduce our panelists. Please welcome Dr. Lindsay Davidson-Klukies. She is Associate Medical Director for Trauma Services at St. Louis Children's Hospital and is an Assistant Professor of Emergency Medicine at the Washington University School of Medicine. Please also welcome Robert Jordan Jr., Human Resources Specialist and retired St. Louis police officer. Richard Rosenfeld is the Curator's Distinguished Professor Emeritus of Criminology and Criminal Justice at the University of Missouri, St. Louis. Professor Rosenfeld's research focuses on the social sources of crime, crime trends, and criminal justice policy. He's a fellow and former president of the American Society of Criminology. Last and certainly not least, we want to welcome Keith Jefferson, North St. Louis resident and community activist. So thank you, panelists, for joining us today. So let's get started with this important topic and really get to the heart of the matter. We're going to start talking about violence as a public health issue and public health funding related to it. So Dr. Klukies, we're going to start with you. Many years ago, health and violence weren't used in the same sentence together. For those who are unfamiliar with framing violence and gun violence particularly as a disease, can you talk to us about what that means?
Absolutely, and thanks for having me. So like you mentioned, firearm injuries and gun violence is a disease, and it's really as simple as that. This is truly an epidemic, And in the midst of the coronavirus pandemic that everyone is talking about, we've seen worsening of this firearm epidemic. And so when we talk about it as a disease, I always like to define what an epidemic is. The Center for Disease Control, or the CDC, defines an epidemic as the occurrence of more cases of disease than expected in a given area or among a specific group of people over a particular period of time. And that's really what's happening with firearm injuries. So we know in the medical community that us as physicians, as scientists, we should and we can help reduce firearm injuries and firearm deaths by taking a public health approach to this epidemic. And by doing so, I really do believe that we can cure this, but we have a lot of work to do. So I think when you talk about it as a disease and as a public health, and by taking a public health approach to it, you really want to talk about the 4 steps to do so. And the first step is to gather data. So we need to look at the numbers. We need to look at the epidemiology and the statistics. We want to know the patterns of age and injury and racial and ethnic distributions, because if we don't know these numbers and if we don't have that research, then we cannot address them and we cannot reduce those numbers. So that data allows us to target our prevention interventions. And then once we know that with a public health approach, the next tier is to work to identify specific risk factors and protective factors, and then develop and evaluate interventions. And then once you have evidence-based interventions, you work to implement them and to assure widespread adoption of your evidence-based interventions. And I think we need evidence-based methods that are acceptable to all patients, all clinicians, and all communities.
Beautiful. Thank you very much. So let's talk about the statistics that you mentioned to set the groundwork for this. What are medical providers in St. Louis hospitals seeing? And then what is the medical community doing to address what we're seeing in the hospitals with gun violence?
Sure. So this year, we have been breaking records at St. Louis Children's Hospital. And I want to clarify that I'm a pediatric emergency medicine doctor. So I predominantly take care of children. So we have been breaking records with children being shot. For 2020, and it's not over yet, but we've already surpassed the total firearm related injuries that we've seen in our hospital for this year compared to any year in our hospital history. And in the past decade or so, our volume has been increasing, but this year it's really substantially increasing. And when you look at our patients, the ages of our children are getting younger and the severity of our injuries are increasing. And when you compare our hospital to most other children's hospitals around the country, we see significantly more children injured, by firearms. So, as much as it saddens us, it's also motivating our medical community right now. So we're starting by talking about it, simply by talking about it, by in the media, in panels like this, talking about it with our community members. We're not accepting this problem, and we're trying to normalize the conversation and to change the conversation to one of prevention. So we've been raising awareness by talking about it through the medical community, by different awareness days like Injury Prevention Day, Ask Day, and Gun Violence, National Gun Violence Day. And we are also focusing on education. So we're actually working on education to medical professionals, including physicians, on the importance to talking about families, about access to firearms and safe storage, and the importance of educating patients and their families for access to lethal means and gun screening in general.
Thank
so we've
you.
been doing, sure. And then the other thing I want to mention is our hospital violence intervention program. So we are lucky to work with amazing social workers in our hospital systems, both the Life Outside of Violence program and the Victims of Violence program at St. Louis Children's Hospital. These are amazing mentors and social workers that identify these patients. They try and prevent further injury and further violence from happening in their lives. They link them to community-based program. They offer support, and it's an amazing, amazing program.
Thank you very much. So I'm curious to know, digging more into the data of what this is looking like, what you're seeing in the hospital. I'm curious to know if you see perpetrators of gun violence in your practice, and as well as the victims. And I'm curious to know, obviously the shooting and the experience of that is traumatizing. I want to maybe get your perspective on the extent to which trauma is a factor for perpetrators.
Sure. Yeah, it's not unusual for us to see perpetrators and victims, and unfortunately, even with children, we've had patients that we've seen who have been shot more than once, and they're still considered children, and so this is obviously not acceptable. The trauma, the childhood trauma, and related to further perpetration of gun violence is a hot area of research. We know, I think, it's really a combination of things. It's a combination of community and relationship and individual and societal factors that contribute to the risk of youth violence. We do know that there are many victims of violence who then go on to perpetrate violence, and that's really the target of our hospital violence intervention programs is to curb the recurrence of violence. And we also know that there are other risk factors like alcohol or drug use and high emotional distress and low IQ and poor family functioning and poor school involvement. So those risk factors are linked with youth violence. We don't necessarily know if they're the direct causes of violence, but that's where we try and intervene.
Thank you. Thank you for speaking to that. Look forward to that research being published. I want to shift topic a little bit and talk about the ways in which perhaps public policy contributes to the prevalence of gun violence. And Mr. Jordan, I want to throw this to you. The Missouri legislature passed a permitless gun laws, right, where anyone over the age of 18 can carry. I'm curious to know if that law requires legal purchase of the carried weapon, and if you know of any correlation between recovered weapons and weapons that were purchased legally. Looking for the connection there between the legislation and if we can connect that to gun violence based on the weapons that are being used. Can you speak to that, you or Professor Rosenfeld?
Well, what I would say is, as far as accessibility, legal, of course, the idea is to have a legally owned gun, legally owned weapon. But weapons are passed down by family members as long as that weapon isn't stolen or retrieved in a negative way or against the law, which you can't tell unless that individual seeks to go have it checked out by the police, or he or she is stopped unlawfully for doing something that he or she shouldn't have been doing. So guns are there. Now, it's the requirement they would ask that you go purchase a gun legally. That way you're in the system, but the law also indicates you don't have to have a license, a permit rather, to purchase that weapon. It can be sitting on your front seat. So the accessibility, and you can't really dictate those numbers unless an arrest or recovery is made of that weapon. Then you can tell. And that's hard to do now with the laws being the way they are. Because like I said, people get guns. You got guns that are handed down from family member to family member to family member, or given, say, hey, it's legal. It's a good gun. You can have it.
Gotcha.
How do you justify that? What can you say? They just throw it in the car, in the waistband, and keep walking. And since it's legal to do that, how can you count those numbers accurately unless you ask? And what individual do you know, especially in some of the communities within the city of St. Louis, is going to come up and say, hey, check my gun, or even approach the police? And especially people of our culture, of our race, that won't go to a police station. There is a fear of police in some aspects, especially if you walk in there with a weapon and say, can you check this out? Will you do this? I really don't see that happening until you build some relationships in that aspect and even that trust factor. So that's something that's hard to maintain and hard to count, especially with Missouri state statutes being what they are now.
Thank you. Professor Rosenfeld, do you have anything to add to that?
Yeah, I'd like to add just 2 points. One is that researchers from Johns Hopkins some years ago looked at the impact of removing the requirement for a permit for a weapon on homicide rates in the state of Missouri. And it was a very sound study, and they found good evidence that homicide rates, gun homicide rates specifically, increased after that legislative so-called reform was passed. The other point I would make is that the guns that are being recovered on the street now, the guns that are being used in crime now, are increasingly very high caliber weapons, weapons that are much more likely to produce fatality when they're discharged. These are weapons in which multiple rounds can be discharged from large magazines holding up to 30 rounds. Multiple rounds can be discharged in a matter of seconds. And that, of course, increases the chance that the intended target is killed, but also that bystanders with nothing to do with the dispute are killed as well. So we've got too many guns and increasing numbers of highly fatal firearms on our streets.
Thank you for that. And then we pull in also what Dr. Kluge said about that social and emotional piece, and the rise of retaliation and the other mental and cognitive issues that go along with that as well. And that's a great transition to an audience question from Catherine D. Catherine D asked, how can we expect an end to end the gun violence in our urban streets when a fear of gun violence on the part of those who serve and protect is such a common occurrence that residents refrain from using the police for protection and instead feel that they must protect themselves and the few others that they hold close? I want to maybe ask Mr. Jefferson if this is something he can speak to. If to Catherine D's question about this balance between residents feeling the need to protect those themselves and those they care about, and the police violence or police being afraid of gun violence themselves. Can you speak to that for us? We can't hear you. Almost.
Okay, can you hear me?
We can hear you loud and clear.
Okay. Basically, like Mr. Jordan said, basically when you're dealing with African Americans, basically in a predominantly Black neighborhood, you're gonna get the sense of not calling the police. This is why most crimes are not solved over there, because they have a code just like the police have a code. They're not going to tell. You can't get anybody to come forward to do anything right, except try to get a retaliation. Until we can get building relationships with the police department to come in to sit down and talk to some of the residents, you're not gonna get this problem situated. You have more guns on the streets, like Mr. Jordan said, that's been passed down. You got some that's been handed around, and until they're caught and you find out that this person, the gun that this person has a murder on it, it might not even be linked to that person because the gun has been passed down so many times. I lost a son to violence in 2017. And to me, it hurts because as I grew up young, we always had the police that was in our community. We had the people that looked like us. That way, you have somebody you can talk to. Now, when you call the police, it's a totally different band of officers. So if as a business owner in a community, if you don't stop and associate yourself with those businesses, with those households that live there, you're always going to have a problem. It's always going to be a broken band going on, because most people in the communities feel as though we'll handle our own problems. The police will get called only if they have to get called. So to that question, it's not an I situation, it's a we situation. We have to start restoring our neighborhoods. We have to start restoring and building the relationships with not only the community leaders that we put in office, because you only see them when it's time to be reelected. You have to have strong block units to where you invite the police officers that are patrolling your area so they can understand and have a better feeling of who that they're protecting. Policemen they take a job. They take a job simply to protect people that they don't know. So I understand the situations sometimes that they go in, because you're actually putting your life on the line for a citizen that you don't know. But it has to be some type of training that goes on with the community and the police department, the fire department, and everybody else that's supposed to be served and protecting, so we can have a better understanding of what's going on in our communities. And you'll be able to solve some of the simple things just by communication.
Thank you. Thank you. So let's shift and talk about place-based sort of perspective. And particularly, we're going to focus on North St. Louis City and the social determinants of health that are contributing to gun violence. So programs like Life Outside of Violence were created to fill some of the gaps that physicians like Dr. Klukes are seeing when working with Missouri's underfunded public health system. So this program works to reduce hospital recidivism, and particularly among youth, by addressing some of the underlying causes of violence, including racial inequity, poverty, and other community factors. So let's explore some of that. I want to toss to Mr. Jordan this question that was mentioned earlier about racial inequalities related to victims of gun violence, and also related to who perpetrators are, right? So when we look at racial inequities, we know that Black youth are more likely to be associated with perpetrating violence in this city, as well as being victims of it. But I want to get at this idea of racial inequality being a cause of gun violence. Can you speak to that, sir?
I will say yes. I mean, for example, I grew up and I still live in North St. Louis. So when you come out your house, it's a totally different look. The schools now are closing down in our areas. Okay, there are no neighborhood stores. The buildings are dilapidated. All right, you don't really see the police, so you can't build a relationship. So you come out being groomed in an environment that says this is a norm. And that environment is inclusive of violence. Violence to survive, violence to make it. That's the understanding. By the time you get to a certain age, you may be given a gun. You may be taught this is a way of life. Okay, there's no jobs, there's no steady jobs, no one can get a job. You don't own your own property, you're renting, and usually you're renting from someone that lives nowhere near the area. So he or she has no impact or interjection on what's going on. And look at the schools. Look at the schools. There are no schools in the community of North St. Louis. So you're taught by the streets, and you're taught a way of life that's inclusive of survival and making it and doing what you have to do to get ahead. It's hard to press forward when everything around you says this is a normal way of life. And after a while, PTSD, that disorder becomes a norm for your livelihood, your life within that community. So you don't know anything else. So going to the hospital when you get shot, and maybe Dr. Klukes can speak on this, recidivism. You see that person coming back. You see them coming back, even the perpetrators, because why? They've grown and they're taught this is a normal way of life. This is what I see when I walk out my door. Why would I talk to the police? Why would I go to the police with my problems?
Thank you.
Because they're going to shoot me first and ask questions later. So the whole mindset with guns is shoot first, ask questions later. I'm not saying it's right, but when I grew up and when I was growing up, we had the interjection of the community, and there are things that you did. If you fought, you fought. And then you walked away, you made up, and you became friends. But now there's an interjection that says, listen, you're taking something from me. And if you're taking something from me, I'm going to take your life. I'm going to shoot you. I'm going to harm you. Why would I call the police? You hurt a family member of mine. I'm coming for you. And so we've taken our schools and those people that we can look up as heroes in our communities, the teachers, we've taken them out of the community. You go to school, you might have to get on the bus at 3, 4, 5 in the morning to go to a school far away from home and come back. What does that do for you? What does that do for your mentality? What does it do for your psyche when you see this as a way of life every day? You see this in your community every day, and you'll hear politicians say, we're going to do better, we're going to build better, we're going to interject more within that community. But you become angry and you don't even realize you're angry. You become stressed, you don't even realize you're stressed. Because it's a way of life, it's a norm. That's the norm that we have to abolish. That's what we have to work on. We have to build relationships. These are things we need to do, and that we have to lean on those that we have elected to office to do so.
Thank you for that, Mr. Jordan. Thank you. Professor Rosenfeld, I'm really curious to know if you can clarify for us some of those known social determinants that contribute to gun violence and also the perpetrator's ability to get away and perpetuate again and again. Can you clarify some of those things for us?
Yes. Well, some of the underlying determinants, I think, are going to be familiar to most of the people viewing this program. Poverty is probably number one. Racial segregation has been shown time and again to be associated with elevated rates of gun violence. As you've already heard, persistent high levels of joblessness contributes to the conditions that give rise to gun violence. And what you've also heard is the unwillingness out of fear of retaliation of many members of the community to cooperate with the police in investigating instances of gun violence. And so relatively few instances get solved with an arrest. And even if an arrest is made, in many cases, the circuit attorney will not take up the case. And often that's because witnesses are reluctant or simply unwilling to participate in the process. And the result being that persons who engage in these activities are in effect held harmless, and that's a recipe for repeating the act.
Thank you. Mr. Jeffries, we've talked about the physical features, social features, economic features, and even historical features, right? So when we talk about segregation, for example, it's not just the composition of a community being Black, but it's also the history of where the money goes, right? And if the money leaves when a community becomes predominantly Black. So I want to make sure when we speak of those things that we're not just talking about race, we're talking about racism and how economic power is leveraged or deprived from communities. So I'd like for you to speak about the stretch of North St. Louis City that was mentioned in the article here on Grand. And I want to really ask the question, can we properly characterize what's happened to that area as divestment, and what's the significance of naming it as divestment?
I don't know who actually classified that as divestment. It is basically you can tell where the money's going. You can tell what's more important between the north side and the south side. You have a major university that's down Grand that has bought practically everything down there, and then you have a HBCU college that's right behind it that has a small portion of that property that's over that way. Like Mr. Jordan said, we've been taught the norm of coming out of our homes and looking at everything that's around us that have failed. So as parents come out and see their children that can't go to school, the schools that they want, because if you live on this side of the street, you can only go to this school. If you live on that side, you have to go to this school. We just had yesterday, I think, 5 schools that just closed within the north side. So that's 5 more schools that we don't have the opportunity to go to. When they did this DSEG program, they took all the top athletes and put them in all of these county schools, which left all of our city high schools vulnerable. Nobody wanted to go to the schools. It was supposed to be a 50-50 program. They sent who they were sending from the county down here. Once they got down there and didn't see the amenities that they had back at their school, they went back to their school, which in turn, we lost revenue that we were supposed to be getting in our schools. As I talked to a Dr. Nichols the other day, the principal of Sumner High School, they were actually making a decision that day to close his school. And I talked to Dr. Nichols for about an hour. And as I left, he found out that his school was on the board to get closed down. So it has to be, everybody has to have accountability. We have put people in office who have gotten there. They have forgotten about us. They have made careers out of the positions that they have. They have taken advantage of the people that keep putting them in there. And at some point, we have to be the people to say, when do we get tired? Because we'll complain and complain and complain, but then it's never nothing to change the norm. So until you change the norm, you're going to have the same problems going on. As I go and see all of everything that's going up and down Grand and Lindell and all, everything looks beautiful until you cross back on this side. like Mr. Jordan said, dilapidated buildings. We got schools now that are closing in neighborhoods that are dilapidated. We have homes. So when you come out and you see that and it's part of your norm, your whole aura just goes down. So hopefully within the next couple of months, we decide to put some people in office that have our best interests. And as I'm polling people in my community, everyone's mad at all the officials that they placed in office because they haven't seen them. But rest assured, you'll see them when it's time for re-election, and the whole neighborhood is posted with boards with their pictures on. Most of these constituents don't even know the people that's in office.
So let's talk about what it takes. Let's talk about what it takes to change the curve. Let's talk about what it takes to transform the norm. Let's talk about what it takes to improve, and let's identify some of the solutions. I definitely appreciate everything that has been shared about what it takes to revitalize a community, about political accountability to the people being served in that community. And let's dig into that. Let's dig into some of the programs that are out there that are taking this public health approach. Let's dig into some of the public policy pieces, Mr. Jefferson, that you were mentioning as well. And so I do want to toss it to Professor Rosenfeld, as we are more than halfway finished with our broadcast here today. And I want you to just give us some differences and similarities between common programs that we hear about in the community. Focused deterrence is one, and cure violence is another. Can you clarify for people what the logic models are so we can see how those programs are going to yield a different outcome for us?
Sure. Focused Deterrence is a program, actually the NOVA program in Kansas City was based on focused deterrence principles, though the then incoming chief abandoned NOVA. But in any event, as the name suggests, it focuses on those members of the community who are at highest risk for perpetrating violence or for becoming the next victim of violence. Typically, the mechanism then is to call those people into meetings. The meetings are hosted by members of the criminal justice system, but also by social service providers and members of the community, often members of the individual's families, and a two-pronged message is delivered. One, we obviously know who you are, and we're going to do everything in our power to stop the violence. Two, we don't want you to become the next victim or perpetrator, and here are services and supports that can help you get out of the life if you so choose. This is a program the research suggests is quite effective. Those viewers who are interested in it might look, just Google Oakland, California, focused deterrence, and you'll see a great example of focused deterrence at work, though it's been used throughout the country, including in a limited way in St. Louis, and it's been quite effective. Cure Violence has been implemented in St. Louis. The city committed up to $7 million over a 3-year period to implement Cure Violence in 3 communities. It's begun in 2 and will, I think, begin shortly in the 3rd. Cure Violence is based on the principle that community members, if they're sufficiently trained, can reduce violence independent of the effects of the criminal justice system, including the police and prosecution. So the training involves people who are familiar with the community. They're trained to monitor conflict situations in the community and then choose among them those conflicts most likely to result in violence. And then they intervene to try to cool out the participants and prevent the violence. And often that's done with the offer of services and supports for people who are at high risk to become the next victim, high risk to become the next perpetrator. So the 2 programs in that sense are similar. The difference is Cure Violence operates pretty much independently of the criminal justice system, the formal one, and focused deterrence is part of criminal justice system as well as social service operation.
Got you. Thank you very much. So would it be proper to say that focused deterrence is a police mediated, if I can say that, program, whereas Cure Violence is peer-to-peer support?
Yes, peer-to-peer support and intervention. In the case of focused deterrence, it's not simply the police, but the local prosecutor, often the federal prosecutor, representatives of the courts and corrections, probation and parole, all participate in these meetings that focus on those with the highest risk for violence.
Wonderful. Thank you for clarifying that. So I want to bring forth a question from an audience member, Eric F. Eric F. says, in what way can Defund the Police contribute to gun violence initiatives? Mr. Jordan, would you like to take that question?
Well, here's what it is, defunding the police, and we have to get a full understanding. My understanding of defunding the police is redirecting funds that can be better used towards social action. So police answer calls, for example, for a person down or a person dealing with a mental situation, and we go to those not being properly trained. So what you're going to do are social services. So what you're going to do is take those funds and put people in position to handle those, and police can focus more on those violent aspects within the community. And so that's what defunding is. I think the whole thing, when people say defunding, they get this big, broad aspect of, whoa, they want to take money from us. In essence, that's understandable. But where is the money going to go to? It's going to go to putting people in the proper position with the right talents and education to assist those in the community that may be on drug abuse, to assist those in the community that may have social situations that's affecting their home and their poverty level, or to assist those from the mental aspect who deal with mental illness, which is something that still isn't addressed within this country properly. So when you do that, that's where the funding is. All right.
Gotcha.
And that gives police more time to do what we're here to do, protect and serve. And none of this will work. And if I can go back, unless you develop relationships and the funding and everything, even with the two programs you just spoke of, we have to understand that people in some of these communities don't trust the police. None of that can work when you're strictly talking about criminal justice system and applying this. You're talking about, here's how we see it over here. You just talking about locking me up. That's what you're talking about. I can handle it myself. How do we build the relationship? How do we build a relationship when you can ride down one of the streets in this city? And I understand everything that happened with George Floyd, everything that went on, and I understand. But none of our police stations were assaulted. Yet even now, you go down the street, you can't even walk into the police station to do anything because everything's blocked up. From a mental standpoint, this is what you see. And what you see from a mental standpoint is they want nothing to do with us.
So I hear part of what needs to happen is developing relationships and trust, which is a two-way street between community members and police. And I hear that programs that are being effective at addressing gun violence are very much addressing social determinants of health and directing resources to people, particularly around social emotional needs and trauma and real resources that people need as well. So with the last about 10 to 12 minutes that we have, I want to talk about and shift the conversation to a question about economic mobility as a solution to revitalizing neighborhoods. And Dr. Klukes, we're going to start with you with this one. Given that in intake process in medical services, you all get the opportunity to really see intimately into the structure of a family and what their status is, right? Socioeconomic status. How do you frame the relationship between economic interventions and reduction of gun violence?
Yeah, I think that's a great question. We know that gun violence and firearm injuries and all injuries, to be honest, are a health disparity issue, and that we do know that gun homicide rates in the U.S. Are associated with things like income inequality. Actually, Dr. Martin Keller, who is our trauma medical director at St. Louis Children's Hospital, did a study a few years ago looking at all of the children who presented to St. Louis pediatric hospitals who were shot and what zip codes they lived in. And it was almost 100 zip codes that were included in the study. And when you looked at the accidental injuries, which historically about a third of our children are accidental injuries and the rest are intentional, but the accidental injuries, they didn't discriminate. They were spread out throughout our area. However, when you looked at the intentional injuries, a large portion of them, almost 40% of them, were within a 7 zip code area. And this was a few years ago, but those zip codes had an average income of less than $25,000 dollars a year, and that's the kind of data that we really need, and it allows us to target our intervention techniques.
That's startling in so many ways, and very much needed to be communicated. So, Mr. Jefferson, really quickly, I want to call forth this idea that was shared about the NGIA Center, right? So this is the National Geospatial Intelligence Center that's being erected at the intersection of Jefferson and Cass. They're reported to bring 3,000 jobs to that community. And I'm curious to know if you can speak to the extent to which such economic development initiatives have actually transformed the socioeconomic status of the people who reside in the communities where they are built. Can you speak to that?
Well, basically, where you have this, the NGA building going up, they've bought out people who were less fortunate, that were staying in apartments. They are getting reconstructed. They went east, west, north, and south of this place, buying up land, putting people out who either sold it or lost it to eminent domain. The thing is you're still down by downtown with schools being closed, and you have all of this money here. Most people that you're going to hire are already going to come with a degree. They're going to have some type of education. You're not going to hire the little man to do something that's going to be around the building, which is in fact going to cause more crime to go on in that area. When we have these big people that sit down and think about the economic reasons to put these places in places where it was already high crime, high poverty, you still have to have something for the little person to be able to have and come home to. I'm curious myself to find out what's going to go on with that. I would like to see actually the structure of how they're going to do their hiring. Yes. As I see, they bought up the apartment buildings across and down the street from them. So I'm assuming that their employees that they bring from out of town are going to be the residents of those new apartment buildings. Now, the thing is, yes, go ahead.
I was going to say, so that's data that still needs to be collected. And we did have a fact check from the audience about that and your curiosity about the economic piece. And the fact check from the audience was they want to check the claim that poverty is the #1 social determinant of health. And this is what the fact checker found, to your point, Mr. Jefferson. The United States Department of Health and Human Services, through its Office of Disease Prevention and Health Promotion, puts economic stability at the top of the list of social determinants of health and identifies poverty as a key issue. In a 2014 article in Public Health Reports, it reached a similar conclusion, stating, quote, "Evidence has accumulated pointing to socioeconomic factors such as income, wealth, and education as the fundamental cause of a wide range of health outcomes." Absolutely.
Yes.
Absolutely.
Yes, and I agree with that 100%. Like I said, basically, you want to sit down with people to try to deter the violence and the crimes that's going on. But when you put something in the middle of where you've already gotten rid of people who are already at a low point, in society. Now,
it addresses trust for sure.
Yeah, it's like a slap in the face to them. So
yeah, Mr. Jefferson, I'm going to have to shift a little bit, and I'm so sorry. We only have about 10 more minutes, and you'll get an opportunity to say your "so what now what," I promise. In the last few minutes that we have, I know that Professor Rosenfeld would like to say a word about economic mobility and city population loss. If you could say that very briefly, and then we will shift over to our "so what now what."
Yeah, in 1950, the city of St. Louis had approximately a little over 800,000 residents. Right now, we have about 300,000 residents. We've lost 500,000 people in the city. And so many of the problems we've been discussing are related to depopulation and a shrinking tax base. And so we have to find ways to increase the population of the city, and in particular, increase the population of those areas on the north side of the city that have become massively depopulated. We've talked about economic mobility. That means moving up. And the slogan in the community is, if you move up, you're going to move out. That is a major challenge to just about all of the remedies of addressing social determinants.
Thank you, Professor Rosenfeld.
We have to find a way to increase our population.
Thank you for bringing that to the forefront. So we are at the close of our program. We could certainly carry on this conversation for quite a bit more because there is much more to say. This is a complex issue. It's not a simple topic. So we want to spend the last few minutes discussing the immediate steps that we can take to reduce violence over the next few years. So, as you know, at American Public Square, we always close with the question, so what, now what? Right? And this is posed to the panelists. And because we are very short on time, this is your 140 character moment. So make it really succinct, hit them hard, make it really clear. So what, now what? I'm going to start with Dr. Klukes.
Sure, thanks. I want to stress that I think we need a fundamental shift of thinking, that fire injuries and gun violence is a public health epidemic, and that prevention and research is really key to cure the disease. I invite everyone here today and everyone in general to learn the facts about firearm injuries and gun violence, to support evidence-based initiatives like hospital violence intervention programs, and to normalize the conversation and to change the conversation to prevention and to volunteer to better our community.
Mr. Jordan, your 140 characters. So what, now what?
So what I would say is we need to rebuild relationships. We want our communities to be better. So that's the so what. So what? Help us get our communities together, reinvest into our communities and our educational system, and help us do things to build ourselves up, our own property, our own line, and build relationships with the police. Then we can talk with you. Then we can communicate with you. And that's all it's going to change. That's what it takes. Real life communication, real life talk.
Professor Rosenfeld, so what, now what?
Three-pronged, not solution, but program to address the increase in violence. First of all, we have to subdue the pandemic, which has contributed to the uptick in violence. Secondly, we've got to redouble efforts at so-called smart policing that is both effective and fair, and institute focused deterrence programs in addition to cure violence. And thirdly, we need to take police reform seriously. As Mr. Jordan pointed out, we need to both increase the accountability of police officers who engage in misconduct, and we need to transfer functions out of the police department, such as responding to drug overdoses, responding to the day-to-day problems of the homeless, to those agencies better handled to equip them.
Thank you. Thank you so much. Mr. Jefferson, so what, now what?
My so what, now what is basically building the relationships. Let's restore what was once. It's just a smart method. Be specific, be measurable, be achievable, make it realistically, and everything will happen in a timely manner.
Thank you.
So if we build those relationships, it has to be a we, a us, and not a I.
Beautifully stated. Thank you. So we will have to leave it there. I want to offer a sincere thank you to all of our panelists today for sharing your wisdom, your lived experience, and your professional expertise with us. It's very valuable as we look for solutions together. I'd also like to thank American Public Square, the Kansas City Star, and the St. Louis Post-Dispatch for facilitating this important conversation about community health and well-being. I am very honored to have served as your moderator for today. I would like to thank the Report for America and the Missouri Foundation for Health for supporting these important efforts. The Kansas City Star will continue to investigate the causes, consequences, and possible solutions to gun violence in Missouri. If you want to support the Star's in-depth reporting and solutions efforts, please visit kansascity.com/Missouri Guns. Finally, if you enjoyed this program and believe that conversations like this are important, and they are, please consider becoming a member of American Public Square. APS members help support programs that allow the organization to continue providing a space for civil, fact-based, and much-needed discussion. You can learn more about membership and its benefits by visiting americanpublicsquare.org. Thank you to everyone who joined in today's discussion and provided a question. This conversation will be continued in the coming months, and we hope that you'll learn from this conversation and find ways that you can be engaged in transforming your community, acting on those social determinants of health, and making it a safe place where we all can thrive. Have a great afternoon.